Good afternoon. This is Mayor Turner. I just wanted to give you an update on where everything stands right now. Start like we normally do with the surrounding cities. Amarillo is at 134 cases. City of Lubbock is at 307 cases. City of Abilene is at 61 cases. San Angelo is at 35. Midland is at 32. Wichita Falls is at 56. And Odessa is sitting at 43 cases right now. In the state of Texas, there's 13,906 cases of COVID-19, along with 287 deaths. So the virus is still very active. You have heard a lot of people talking about getting the economy back going. You're hearing a lot of that on the national news. Let me clarify something just a little bit. There were places such as New York, the states up in the Northeast that were hit earlier than us. And some of them were hit very hard, especially New York. Those cities have been fighting this longer, and so they're almost at the top of their curve. And that's why you're hearing a lot of talk about getting the economies back up in New York, Pennsylvania, Connecticut, and those back up on their feet. We're not there yet. We are still watching the numbers. The numbers are climbing fairly quickly. As you can see, with Lubbock has 307 cases. Our friends to the north are struggling with coronavirus, especially in Lubbock. So what we're doing, we're just keep going like we are. Asked you time and time again about what we need to be doing. Wash your hands, stay 6 feet away. Also, make sure you're social distancing. Some people have asked, well, you hear about COVID-19 and you say some people are more susceptible. Let me tell you about the people that are at higher risk than the average individual. And they said it comes from a CDC handout. You can get this at cdc.gov. And it's basically people, from what they know, it says based on what we know, those at higher risk for severe illness from COVID-19 are people of 65 years or older, people who live in nursing homes or long-term care centers, and then there's some other people that can be younger people that may have a condition that can make COVID even worse. Those are people with chronic lung disease, such as moderate to severe asthma, people who have serious heart conditions, people that are immunocompromised, and I can give you what those are. Since many of these can cause a person to be immunocompromised, including cancer treatment, smoking, bone marrow or organ transplant, immune deficiencies, poorly controlled HIV or AIDS, and prolonged use of corticosteroids and other immune weakening medications. People with severe obesity are have an underlying condition, people with diabetes, people with chronic kidney disease undergoing dialysis, and people with liver disease. So these are the people that it will be a lot worse for them if they get COVID-19. And people especially that have conditions like this, we are suggesting that you stay home, let people go get your grocery stores, or call and have your groceries delivered if that's an option. So those are some things that we've talked about, but we just wanted to make sure that you knew who was at a higher risk. You're also hearing the CDC talking about masks. These are not the N95 masks that the medical people are wearing. These are the colorful masks that you see everybody wearing when you go to the store. If you get outside your house, you're going to see them. There's lots of different ways to get these. You can order the mask, but you can also make your own mask. And they are going to put this CDC handout, which tells you how to make a mask. And there is no sewing required. It's step by step. You can make it out of an old t-shirt. You can make it out of an old sheet or anything like that that is around your house. And so even for somebody who can't sew like me, you can make your own mask. This mask is mainly to protect people that have COVID from giving it to somebody else. Say, I don't know I have COVID, and I go out into the community and I start coughing somewhere, the droplets that come out of your mouth are where the COVID is. And if it goes onto a surface and somebody else touches it, they could catch the COVID virus that way if they touch your face. So the CDC is wanting everyone to start wearing one of these. Like I said, you can make it, you can buy it. Downtown Odessa is actually handing some out. They've actually had some made and are giving them away. So there's lots of ways you can work to protect yourself. And a lot of people have heard that Governor Abbott was going to come out and talk about getting the economy back on its feet. He came out today and talked about a program for small businesses just to help them with working capitals. That's what the announcement was today. But I will continue to watch and see what Governor Abbott is saying and let you know what's going on. From now on, we're going to do these at 4:30. This will be linked to the city page. I'm in the process of setting up Instagram and Twitter so that we can get it out there. And we're starting to move that way. All in all, what I'm simply trying to say is COVID is still very dangerous. The city is doing a very good job. A lot of people are staying home. The places you want to make sure you check are when you go into the grocery store, make sure you're staying 6 feet away from someone else. If you have a mask, that would be a great time to wear your mask. It would be in a grocery store, or maybe you go to Lowe's or Home Depot. Wear your mask then. When you really want to wear it is when you're around other people. There's no use in wearing it at home, just when you get outside. You are continued to be in my prayers, my thoughts. Let's everybody practice the set steps that we've talked about. 1 is stay home if possible. Number 2 is wash your hands often. If you touch something that you're not sure it's clean, wash your hands or use hand sanitizer. Avoid close contact, 6 feet, or it's basically 2 arms lengths. That just makes it a little easier. Always clean and disinfect everything you touch, especially if you're getting out into the community. And right now we're just staying in place. So I want to tell you a little bit about something I talked about last week. We've got some amazing individuals manning what's called the EOC, which is Emergency Operations Center. They are watching the community in an overall view. They are watching the number of cases that go into the hospital. They're watching the people that get out of the hospital. They are monitoring the numbers. They're monitoring the state. And their entire job is just to make sure that this community and the community leaders know as much as we can. They watch the ventilators at the hospital to make sure there's ample supply. They're monitoring how many people are in the hospital with COVID, and that's their whole job. It is right now manned from about 7 till about 5. If COVID keeps progressing, that could end up going 24 hours a day. So that's what they're there for. They're some of our bravest. They're firemen, they're police, sheriff's office. Everybody is involved with the EOC, and they are working on, Judge Hayes has been working behind the scenes to start to set up a mobile testing center, or a testing center where you can drive to, get tested, and then leave. So I will have more details coming later this week. But like I said, the video is going to be 4:30 every day, Monday, Tuesday, Wednesday, and Thursday. So please stay safe. Bless every one of you, and thank you very much.